So my brother, I think he's now 14, and he's always struggled with feeling like he's heavy and he weighs more than other people. And it reached a point where he was classified as obese, and he's only 14, so that's always been something that our family and everyone has had to deal with, especially now since he's been classified as obese. And well, he's currently at school and he's studying, I think, his second year of secondary school. So it's really hard being 14, a teenager, and being obese.
Yeah, for the bullying and that type of thing.
Exactly, because at this age, kids,
He suffers that?
he suffers, especially now since he's been classified as obese. Before that, he's never been a thin boy. He's always been quite heavy and quite overweight. But recently, because of the way people have always seen him, instead of trying to lose weight, he thinks, well, I'm already fat, I might as well just carry on eating and carry on not helping the situation.
And
you
in
know,
the family, you tell him something about that
well,
problem when he eats or whatever?
yes, we try to encourage him to say, hey, like, this is very unhealthy, especially because you're 14, and especially at school, because everyone else, when you're obese, that means that you physically can't do some things. For example, when you go to PE class, or when you have to just even walk to a supermarket or some like close place.
And you try to help him, maybe to tell, okay, Jack, just come on and we're going to do a walk or whatever, or
it's really hard to help him because he doesn't feel motivated to do anything. He thinks he's obese or fat, and he just doesn't even want to try. We have tried to encourage him, because in our family none of us are actually overweight or fat. It's just him, and we don't know why he feels like he needs to carry on eating and not do any exercise. And we've discovered, or we think, that there's something deeper happening. And we realized, you were saying, at school he's actually being bullied, and we didn't know this until recently, because he was gaining more and more weight instead of losing it, and we didn't know why. And we realized it's because of the friends. They all made fun of him. So instead of actually encouraging him to actually say, hey, come on, let's go to the mall together, come on, let's do this and that, everyone just made fun of the way he looked. So he thought, why should I try and lose this weight when everyone's already making fun of me? So nobody actually encouraged him to maybe lose weight, even though his family does, but he's a teenager, so he doesn't really listen to his family.
Yeah, because maybe the other,
he thinks more about his friends.
Yeah. And you go to the doctor?
Yeah, so we've been to the doctor, and the doctor has said that the only way to lose weight is by actually having a diet, or like restricting to 3 meals per day, and not completely cutting off food, because that would be unhealthy. You need to still have 3 meals a day, and also at least go for a walk every single day to start with, because now that he's obese, it's really hard to start immediately going for a run or eating like small amounts, because that's impossible. Like, it has to be progressive. So we've started this now, and although it's been quite positive for him, he still is not happy, and he's still bullied at school. So that's something that's really hard, and the way that friends just make fun of him all the time is just not
That's
nice.
hard.
Yeah.
So what type of language do you think that you going to use when you talk to him is the correct one?
So I think
for everybody.
Yes, I think if everyone just accepted him as an equal, then like the society in which we live now classifies people by appearance, by the way they look, if they're tall, thin, fat, if they're different races. And I think as well as all of this matters, when you're obese, the way in which you talk to someone is crucial. So I think you need to try and be positive and say, hey, or not even mention it. Just treat him as an equal, and he'll be able to see that he's actually like everyone else. He's just got a few extra kilos that he has to get rid of because it's unhealthy.
Maybe if they friends, they say, hey Jack, just come on, they do a walk. Maybe he's going to do the walk instead of going with you.
Exactly. If they invite him just to like even go for a run or for a walk or something, if they just like accept him as an equal and say, hey Jack, come with us, like it's fine, like you don't have to worry, like not even mention the weight thing. I don't think they should even mention it. I think it should be something that it should be internalized and not said or talked about. But yeah, I think that's what should happen.
So how important do you think is the paper of the correct language when you're talking, when not talking, treating young people with obesity, or I think obesity, or maybe another eating problems?
Yes, I think that this type of people that struggle with obesity or an eating disorder, I think for starters, they know that they have this problem. So why do you keep talking about it when in fact, in some cases, it could just make them feel worse? Especially when their friends around always make fun of their weight or make fun of what they look like. So when you go to the doctors and you explain your problem and you say, hey, this is what problem and how can I get help, I think the way in which they use language is really important. I think they should actually say, hey, you need to understand you have this problem, but at the same time, it's okay. Like, it's okay that you're like this. Like, it's okay. We're all different for different reasons to become obese, but there's a solution. If they talk us, there's a solution, and from a positive mindset, I think the patient will actually feel encouraged to actually feel like, hey, you know what? Yes,
it's okay. Just start. Yeah.
It's okay if I start today. I can start today, and every single day start progressively, and one day I'll be like, hey, I've lost whatever kilos or pounds. So it all starts with your mindset and the way you see yourself. So it's okay if you start today or tomorrow, as long as you start, and as long as you know that everyone around you actually cares about you and they're not making fun of you. So by just using this positive mindset, we can reach a lot and get to lots of different places.
So in conclusion, this is the type of talking language that they need to use. Everybody, with some people that have problems.
Yes, medical professionals, friends, family, everyone needs to be aware that this person doesn't need to know that what they have is actually horrible. No, they already know that.
Yeah.
So why keep talking about the negatives when you should actually encourage them and say, hey, do you want to change? Yes, so let's start now. And don't care what others say. It's really hard when you're a teenager, that's normal. But if you just say, hey, it will change your quality of life, it will change who you are. And I know it's really hard to change from one day to another, but just start today and see what happens.
Yeah.
And encourage them.
So thank you very much, Jaina.
Thank you.